no role of prolactin. We only do it when we are suspecting hypo or hypogonadism. Otherwise, we never carry it out. In a normal man, we don't carry out prolactin testing. And what was the second question you wanted to ask? One more question you had, no?
So, in case of finding the low testosterone level, what are the things I need to work out?
So, find out why the man is having low testosterone. Either the pituitary is not working. When pituitary doesn't work, then the Leydig cells won't work. So, you'll have low testosterone. It's called hypo. Other is hyper, where pituitary is overactive, but testis is not working. It is called hyper. Then there can be idiopathic hypogonadism, where the man is absolutely okay, but we don't know the cause of his hypogonadism. We don't know why the testosterone is also there in the body, but testosterone is not working properly. Then again he can have hypogonadotropic. Here he'll have idiopathic hypogonadism. But in idiopathic hypogonadism, we don't treat. Till the time FSH is less than 6 or 7, we don't treat a man. When somebody's FSH goes more than 8, this means that he's going into testicular failure. So a large number of people, they give clomiphene and letrozole or anastrozole to all the men who's coming to them. That should not be done. But once you give somebody clomiphene or you give somebody letrozole, what is the main purpose? We are trying to have more endogenous FSH, isn't it? We want endogenous FSH. If the body already has high amount of endogenous FSH, then this may not work at all. So for you people, since we have not taught you andrology in that big amount, we'll have a curtain laser very soon on the medical therapy. It's a very nice 1.5 hours curtain laser. But you should know that every man, whether to give medical therapy for hypogonadism or not, it is only indicated in hypo and nowhere else. In case any man who has got normal FSH or raised FSH, we don't give normally clomiphene or letrozole. Idiopathic you may give. But it's again after talking to them. But hyper, or when the levels of FSH are raised, we never give anyone medical therapy as per which guidelines? As per the guidelines of ASRM. They have come in 2024, guidelines of European Union of Andrology. 2024, we should not be doing these two things.
So what can be done next in hyper?
Hyper, nothing can be done. It is a non-obstructive azoospermy.
Yes.
Then you have to carry out, many people give anastrozole. You have to introduce yourself first.